Welcome to Hopeful Hints. I'm your host, Dr. Tara, and today we are going to be talking about the top 5 labs every woman should ask for, even if your doctor or a healthcare provider says you're fine. So, have you ever been told that your labs are fine, even though you feel anything but fine? If you've been dismissed or told it's just stress, or blaming your physical symptoms on one of your many external circumstances, work, life, etc., you're in the right place. Today's podcast and video, if you're watching on YouTube, is going to arm you with the top 5 labs I believe every woman should know about so that you can stop guessing and doing all of this research and homework online and social media and actually start feeling better and even healing. So, today we're going to actually be pulling back that curtain on why normal does not mean optimal. And I will be talking a lot about this in upcoming episodes because that is a common theme in my clinic is every woman will come in, or male, and say they had all of this lab work drawn and everything is normal. And those standard lab ranges are actually keeping you stuck in a cycle of symptoms. And it's continuing to be brushed off or ignored. And there's actually stuff going on with your body. Those symptoms you're experiencing are symptoms from your body saying something's not right here, please help. So I'm going to show you how to read between the lines and advocate for better care and the kind of care that gets you feeling better and like yourself again. I've actually been privileged to help thousands of women get real answers after being told that everything looks normal. So stick with me till the end. And I'm going to not only share the labs with you, but I'm going to teach you a little bit about how you can ask for them on your own and how you can kind of even just get those labs on your own. Again, normal lab results don't mean much, truly. When your provider says your numbers are normal, as I'm air quoting, what that really means is that they fall in a reference range created by averaging results from a large group of people many years ago together. And many of those people actually were already sick or had situations of their health going on. You're being compared to a general population, not to what's ideal for thriving. And functional med tends to look more at optimizing, not just diseased. So our reference ranges are tighter, I guess you could say. And they're actually based on evidence-informed ranges. And there's plenty of research to back this style of healthcare. What optimizing or optimal health looks like is actually supporting energy, focus, mood, fertility, longevity, and so many more things, where traditional lab testing focuses on broad ranges designed to detect an actual disease state going on, not catch a dysfunction before it turns into a disease. So you can fall within normal ranges and still feel exhausted, anxious, all the things which we're going to go over today, or like a stranger in your own body. That's why we look deeper. When hormones are off and things are off, there really is power in getting a second opinion or adding someone to your healthcare team. So let's dive in and talk about the number one. Thyroid gets dismissed all the time. And we're going to have a whole separate podcast, and I have a whole separate module in my group coaching program dedicated to the thyroid because it just gets forgotten. So most healthcare providers only run a TSH. And that's like checking the thermostat, not the actual heat. Like that is one teensy-wincy piece of your thyroid. Patients will come in and be like, oh, I have my thyroid checked. And I look, it's like a TSH, if I'm lucky, a T3. That's it. If you are continuing to experience, here's some symptoms I want you to kind of be making note of that might be a sign of your thyroid, but fatigue. You're sleeping all day and all night, sleeping good through the night, even taking naps, you're still fatigued. Cold hands, feet, or you're always cold, or you don't tolerate heat well. Dry skin, hair thinning or hair loss, brain fog, forgetfulness, slow digestion or constipation, depression, puffy or swelling face or extremities, irregular menstrual cycles or really heavy cycles, anxiety, heart palpitations, infertility, miscarriage, some voice changes or like you're clearing your throat all the time, slow wound healing. We look at multiple things, but the important takeaway is free T3, free T4, TSH and antibodies, and even a reverse T3. Your T3 is your actual active thyroid hormone. And then your T4 is the stored thyroid hormone. A little bit about reverse T3 too. This blocks the effect of T3, especially when there's stress and inflammation going on. But those are antibodies, like your thyroid antibodies. You have Hashimoto's going on. That's the autoimmune thyroid disease. And it goes missed for years, or even if it's like mildly elevated, your provider's like, well, there's nothing you can do about this anyway. Not true, not true, not true. The thyroid actually impacts almost every system in your body, from metabolism to mood to periods to fertility to digestion, like everything is impacted. You can see right there in that quick little snapshot of a conversation how important it actually is and how we need to get those levels honed in more. Number 2 would be sex hormones. So even if you're not trying to get pregnant, a lot of my clients are and a lot of mine are not, you still need every sex hormone balance for mood, energy, metabolism, focus, so many things. Common signs of low progesterone in itself is anxiety, especially at night, insomnia, and that insomnia might even change around ovulation or before your period. If you have spotting before your period or after the time of ovulation, if you're someone with short cycles, 24, 25, those really short cycles, breast tenderness, PMS, PMDD, big mood swings days or week before your period starts. I always say, what symptoms are you having that say, oh, my period's starting? That's progesterone. Miscarriage, I could go on for a day talking about the lack of responsibility that healthcare providers take by not testing and treating progesterone levels in pregnancy. Headaches, migraines before your period. Think any symptoms before that period starts typically are progesterone related. High estrogen or estrogen dominance, which is a whole word I probably just said that most healthcare providers think is made up or not real, and that's not true. But heavy, painful periods, bloating, water retention, cystic breast, mood swings, irritability, weight gain of the hips or trunk area, worsening of PMS symptoms or PMDD, and then brain fog. The other one that gets forgotten all the time is testosterone levels, DHEA levels. When they are imbalanced, you have libido concerns. That's like the number one thing that is thought of. But truly, these are also, as I'm pointing to my head here, these are responsible for mood, fatigue, clarity, brain fog symptoms, lack of motivation, lack of stamina, fatigue as well, hair thinning. And if these levels are high, we tend to see more acne or unwanted hair to our face, nipples, belly. Maybe the individual who has to shave their legs like every day. Hair loss, hair thinning, oily skin. Again, irregular absent cycles, anger or short temper. So there's lots of things that kind of go into that too. My favorite way of testing this, again, even if you're not trying to conceive, is with the at-home urine kits. They're live. They're easy. They're in your bathroom. We're getting live data. So these kits are actually made, yes, for fertility, but also general hormone tracking. So perimenopause, menopause, we use them in those patients as well. I'd really consider getting one of those as well. We also love a Dutch hormone test. And so number 3 would be blood sugar and insulin markers. We're lucky if we see glucose, let alone insulin, but you could have blood sugar or insulin resistance for years before it shows up as diabetes. We don't want you to get to diabetes. And that's all that this side focuses on is when you have the disease, then we'll treat the disease. We don't want you to get the disease. So we don't even want it to show up as that. Some signs of insulin resistance are our patients who are working out. They are dedicated. They're eating so well-rounded. They're still not losing weight. In fact, they might be gaining weight. The afternoon crashes or energy crashes after meals. So if you have a larger meal or if you eat even sugar and you get crashy and feel icky after that, if you have cravings for certain food, sugar, salt, etc., red flag. If you are needing like caffeine to function in the afternoon, again, we do see that mood or irritability swing, like hangry. That's actually a real thing. If you wake up between 2 and 4 in the morning, it could be cortisol or even insulin changing as well. Brain fog after eating, increased thirst or urination. We see this a lot in our PCOS patients. We believe that there's insulin-resistant PCOS as a type of PCOS. But really, those are the common ones that we see. So we want fasting glucose. We actually want that under 80. And then fasting insulin. And that range is ginormous if you look at it too. Our perfect number is 5 in our clinic. Too hot or too cold is with symptoms we treat for insulin resistance. You, of course, can get your hemoglobin A1C. We like that under 5. And so really just watching though for signs like, do you get dizzy or shaky if you don't eat or go too long? So signs of hypoglycemia can actually be insulin resistance as well. Number 4, we ferritin in a full iron panel. Missed all the time. Red flag if you are somebody who had iron deficiency anemia ever, let alone in pregnancy, and then it was never talked about, discussed, or checked again, and you are having these symptoms, really need to go back down that road. Hair loss, fatigue, if your thyroid isn't functioning, this goes hand in hand with that. But we see a lot of hair shedding with this one, shortness of breath or rapid heart rate with minimal exertions, going up steps, doing basic things, repositioning and getting dizzy, laying to sitting or repositioning around and getting dizzy from that. Pale skin, fatigue, weakness, restless legs at nighttime, brittle nails or nail changes, cold hands, cold feet, dizziness, lightheadedness in general, anxiety, poor concentration, headaches. If you're craving ice, red flag. That's called pica. We see that a lot. It's like, oh yeah, I love ice. I chew on ice all the time. Red flag. If you have someone with heavy periods or maybe you got a hysterectomy, but you had heavy periods, chances are you still might have some iron deficiency going on unless you were replacing that and actively working on that. So we want our ferritin 100 or more, not just within range. We actually sent a patient to get iron infusions due to the stupid insurance system. They had to go see an internal in-house provider, hematology, and their ferritin was 15. Cutoff is 13, and they would not do it. All the other ranges were off as well. It's just so frustrating. So really looking for alternative sources. A place like ours, we do give iron infusions if we need above and beyond because we believe in treating those optimal levels. But serum iron, TIBC, transferrin saturation. So these give the full picture. And then we also test B12 and folate. So your ferritin level is like your gas tank, and then your iron level, of course, is showing you the real live picture. But you can be iron deficient, again, without being anemic per their magic range. Our patients really feel ferritin being low and off well before it's flagged on paper. Number 5, vitamin D and vitamin B levels. And especially if you live in the Midwest, vitamin D is so overlooked, and it's more than just for bone health. This is very important for supporting your immunity, mood, inflammation control, hormone health, fertility. So vitamin D symptoms sometimes look like frequent illness or slow healing, bone pain, muscle weakness, mood. That seasonal depression, seasonal affect disorder can really be improved by optimizing your vitamin D levels. Fatigue, poor endurance, again, hormone imbalances are tied directly with vitamin D, hair loss, sleep issues, disturbance. And then vitamin B12 or folate symptoms can be like pins and needles, numbness and tingling to hands and feet, brain fog, forgetfulness. Again, fatigue is like in all of these because I call it like there's a soup of stuff going on, and very rarely do our patients have just one. They have several of these going on. Sores or mouth ulcers, mood changes, depression, difficulty focusing, memory problems, poor balance and concentration. We want vitamin D levels 50 to 80 minimum. I can't tell you how many patients will come to us and say they were told like those levels are toxic, and that's not true. Unless you're having symptoms of toxicity. Then B12, we really want to make sure, again, another thing you could take and add as a little bonus is find some place that'll check if you have the MTHFR, so that you know which kind of B that you should be working with as well. And then folate as well is another optional bonus lab you could call is homocysteine. So that can show B vitamin deficiency and methylation issues as well. It gets just overlooked. We typically look at this more, especially if you're the postpartum mom and not feeling well. That is one that we look at as well. So as you can tell, these levels affect nearly every part of your body, your hormone pathways, and you can really how to ask for these labs, even if your doctor says no. You can, there's many communities and towns that have labs you can just walk in and order your own. I call it like the recipe or the restaurant menu style. So you can walk in and have a lot of these labs drawn on your own. There's a lot of companies with home test kits. You can just order these on your own without an order from a doctor. They get shipped to your house and you can order it. But I really want you to advocate and really bring a symptom journal and say, I want to rule out the root cause of my fatigue and hair loss. And if you can't do it, who do you know that can? Or just making that appointment on your own and not asking for permission from your current provider to do that. Be specific too and say like a full thyroid panel, including antibodies. So the way you word it to your provider, asking specifically for those things. Or I'd like to check my insulin, not just my glucose. So how you word it to your provider can really help encourage them to order that too. And if they refuse at the end of the day, say, can you document in my chart that I requested these and they were declined? That often changes their response too. It's not okay that these providers continue to dismiss the importance of these. If they don't want to be the ones that like roll out your plan of care with them, fine. But you at least should have the opportunity to have them drawn, take them with you, and go elsewhere. And then, like I said, you can also just order these and start working with other providers. We are all about creating a healthcare team and not relying on one person. Oftentimes, this means expanding your team to get some of those things ordered, but sometimes it's just simply how you ask for them that can really pivot that too and help you get that order from your provider. If you're watching on YouTube, drop in the comments, which of these labs have you had tested, or which of these do you think you need testing? And then drop a comment to share your experience too. You deserve real answers, and there's a lot of you going through a lot of the same things. I think it's great to connect with others and share your stories and experiences and be empowered to ask better questions or ask and pivot how you're asking for it as well to get these ordered. I like to say this is the day that it ends. Gone are the days where you just let a provider tell you it's just stress, or maybe you're a busy mom, or maybe you're a busy entrepreneur, or you're a busy female, or blah, 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 blaming anything outside of what's going on in their office that day as being the cause of this. Your body is clearly asking for help. If you're looking for more support as well, or you're ready to stop navigating your health alone, I'd love to walk beside you. Whether you're just needing answers or a personalized care plan or a provider who truly listens, I am here for you. You can learn more about my new coaching program that I opened up where you will get direct access to me. We will work on all of these things together and get you feeling normal. You can check out the link in my bio or the show notes, or you can head to drtaraharding.com and let's get you back to feeling like yourself again. Thank you so much for tuning in this week. I will see you back here in the next video and podcast.